Okay, we're going to look at a couple of traction manipulations, actually three different types of traction manipulations in the thoracic spine. Indications for these basically are for the anterior subluxation, where the whole vertebra is sublux into flexion anteriorly. This is basically a form of spondylolisthesis. Or where the vertebra is translated laterally and we have a transverse subluxation. Now in both these cases what we're going to do is we're going to apply a distraction, a longitudinal distraction technique to try and lift the vertebra either up and backwards or up and towards the midline to recover that subluxation. We've got two ways of doing this. We can fix the inferior vertebra and lift the superior away from it, or we can fix the superior and drop the inferior down away from the superior. The one you pick often depends on which technique you prefer, but it also has to do with relative body sizes. If I have a large patient with a low thoracic problem, I'll tend to use a drop technique and I can let gravity do the work for me. If it's an upper thoracic problem and or a light patient, then I'll lift the vertebra up. It tends to be a little faster. So you've got your choices here depending on your preferences and the body size of you and the patient. Let's have a look at these two in sitting, and then we'll look at a distraction technique that we can do in laying. Okay, we need a stabilizer. So we're going to come in and fix the lower vertebra, either that way or that way. Personally, I prefer that way. So this is going to go up against the lower vertebra here, and of course the partner's below it. The fixation is going to be made with my body, and I'm going to use the cartilage of the lower ribs there. So as I push into him, this gets snugged up against that vertebra. It also gives me the advantage of being able to turn a little bit sideways on. And when I do the thrust technique, it makes it a lot easier than if I'm flush onto them by putting this here. So it'll be on one side. Either side makes no difference, whatever you're most comfortable with. Okay, let's do this from the back and we'll go from there. Can you face towards them, Mark? So we get the patient sitting right back on the bed. They cross their arms, as we say, with the arms parallel, not actually crossing each other. Parallel there, so I can grab that lower elbow. The bed height needs to be where the segment that I'm interested in reaches this level. So we need to bring Mark up some to get this about there. Okay, so I've got this snugged in against me there. I reach around and grab that lower elbow. Now, the thrust actually isn't going to be through the elbow at all. It's going to be through the inferior glenoid tubercles here. So I need my forearms up against those infraglenoid tubercles. The patient puts their head back on you and you get yourself fixed. Now, if I'm doing this for an extension manipulation to regain that flexion subluxation, I want to get him into as much extension as he can comfortably tolerate, which may not be a lot because this can be quite painful. It's not as important for the transverse one. So it's there, I get good contact, I feel the end feel up against me here, and then the thrust is actually me squeezing my arms together and retracting my shoulders. So it's that. Now, because I've fixed below, the patient's buttocks should not come off the bed. Okay, so it's this, there, and I'm fixing him down. If we look at it from the other angle, spin around for me. There's my fixation again there. He's got his arms crossed. I'm in that position. If you look at my legs, it's a stride position there. He relaxes back into me and it's that. Simple as that. If I want to do the drop technique for a lower problem or a bigger patient, just relax for me, Mark. Now I want to fix the superior vertebra. So now the stabilizer will go that way and I'm going to drop this one away from it. Otherwise, everything's the same, except from being there, it's now there. So my fixation is still on the ribs there. Like so. His arm positions are going to end up being the same, but the technique's going to be a little different. Let me show it to you with him facing the camera. Because what I've got to do now is I've got to get gravity to take him down. Now I need the bed up a little bit higher again. There. Grip is exactly the same under the arms, he relaxes the same, but now instead of me lifting, I'm going to rock backwards and forwards. There. And then the thrust is, as I come back, where I'm getting traction now, as I lean back, his body weight is dropping down, I'm actually going to lift him up, drop him and catch him before his buttocks hit the table again. So it's that. Let's have a look at it from the other angle again. Okay. There's a stabilizer. Now, if you watch my legs, you'll see what I'm doing. I'm just rocking backwards and forwards, but I'm not extended. Now, if you're extending your spine while you do this, you're going to hurt yourself. All this stays fairly rigid. And as I lean back, I actually draw him this way. Now, the lift, if you look at my foot, the lift will be done by plantar flexing there. But as I drop him down, I actually come down on my heel there and catch him before he hits the bed. So it's this, gives me a little bit of momentum, and then up, drop and catch. Okay. Now,